An estimated 34 million people live with type 2 diabetes in the MENA region, and about 19% of the UAE's population is diagnosed. However, Dr. Job Simon, a consultant endocrinologist at Burjeel Hospital, said metabolic surgery can mainly help those with early-stage diabetes. Dr. Simon also pointed out that no clinical survey has been conducted to offer long-term implications. It was added that chances of diabetes remission were greater with a gastric bypass than with other procedures such as sleeve gastrectomy, although there is no guarantee of success.
Initially, these surgeries were done for morbidly obese patients when all other options of doing diet and exercise failed, and they went for surgeries like gastric bypass or biliopancreatic diversion. They found that quite a few of the patients actually ended up having remission on diabetes, and this often happened before even there was a substantial reduction in weight. So that led us to believe that there is something happening metabolically that is causing this reversal of diabetes. This came as a pleasant surprise. Now that argument has been taken further and saying to say that why not we do surgery for people who have diabetes even if they are not morbidly obese, because they are already having a disease which could progress and result in higher death rate. Type 2 itself, we are understanding more that there is a huge spectrum, especially like patients from India, let's say, who have type 2 diabetes. They tend to be thinner with much lower amount of insulin in their body. Their odds of getting into remission are not as good as somebody who's a classic type 2, which is called type 2A, who are much more obese and sedentary. They have a much higher chance of remission. So it's type 2 diabetes itself is not a single disease. There is a huge spectrum within that. But you have a very high chance of getting into remission, and there's no promise of a cure, but there is at least maybe around 60 to 70% chance that you might achieve remission, especially in the classic type 2 diabetes. So it's not a cure-all, but it's definitely worth looking into.
According to the chairman of surgery and deputy medical director, who has been conducting surgeries on patients from the UAE for over 4 years, patients should only view surgery as a last resort. While advising the public to avoid unnecessary surgeries, Dr. Benhidjeb stated that such surgeries can also lead to further complications as well as death.
The problem is not to reach the complication. Before reaching the surgery and the complication, we must prevent unnecessary surgeries. This is the point, and this is a question of education. The decision to do the surgery, you need the criteria. These are clearly defined criteria. Independently of the so-called standards or guidelines, you have to follow certain ethical aspects. This is very important, ethical aspects, and not to recommend to a patient surgery because either you need the number or because you get the money from the patient. Now the sleeve gastrectomy as such, of course, this is the meantime highly standardized surgery with limited complications. Now if you have, for example, patients with not that much high BMI, the problem is if these patients will develop a complication, you can find out this complication and you can discover it very, very early. But patients with a high BMI, it's difficult. It's very difficult because they are so obese that if they have an inflammation in the abdomen, they don't show a reaction. And mostly if they show a reaction, it's sometimes too late. They go immediately into septicemia, and then they are candidates for